Hey YouTube, what's up everyone? My name is Camilla. I create the Aaron channel on YouTube. I usually talk about intersex related topics and transgender related topics. If you don't know me, my name is Camilla and I'm an intersex woman, also of transgender experience. I create these videos from a non-woke perspective, trying to be in the middle, very moderate perspective on gender transitions. I don't think they should be taken lightly because they are a lifelong commitment. They are life-altering. They are physically alter your body, and a lot of the effects of them are irreversible. So it can sterilize you. It can do lots of things. It can create happiness, and it can create loss depending on how transition works for you. I'm doing a pros and a cons list today. Not a list, I should say. I'm just going to speak on my personal experience. Please remember that this is my experience and I am not giving medical information or medical guidance or advice, because that is not what I'm here to do. I'm just sharing my story. So there's a lot of pros and there's a lot of cons. I'll start with the pros so that I can explain the cons. If you're considering a gender transition, I strongly encourage you, pardon me, I'm sorry, my kitty cat. This is Meow Meow, by the way. I strongly encourage you to seek out the therapist, go to a doctor, a psychologist, a psychiatrist. It's really important for someone to rule out underlying issues like depression or identity issues, because ultimately the reason people transition is because of gender dysphoria. In a nutshell, gender dysphoria is an incongruency from your brain and body. So for a transgender woman, she was born male, but her gender identity, her brain feels female. So what can be done about that, except what they would do in a medical or clinical setting is prescribe you cross-sex hormone therapy or hormone replacement therapy, HRT. This is going to be very beneficial because HRT will allow you to develop secondary sex characteristics of a female if you are born male. I can't speak for trans men. I don't have that experience, but I can only speak on trans women. So this video is geared towards trans women. Getting rid of that gender dysphoria and looking in the mirror and being happy with what you see is what almost all transgender people strive to do. Pardon me. Looking in the mirror and seeing facial hair, short hair, flat chest, muscles, that can create horrible gender dysphoria for a transgender woman or a transgender woman that has yet to transition. Taking cross-sex hormones and giving yourself a lot of patience and time, you will develop secondary sex characteristics. Now, this varies from person to person, but when I say secondary sex characteristics, I'm talking about breast development. I'm talking about fat redistribution. I'm talking about changes in the facial appearance. So my face used to be a lot more blocky than it is now. HRT has rounded out my face considerably. I have not had surgery on my chin, but I have had some facial feminization work. Scheduled to have some more surgery this December. I'm having a brow bone shave and my second rhinoplasty. And we can get into the cons of plastic surgery in a minute, but before we go there, I'm going to continue on these pros. One of them is being able to express yourself, like truly be yourself. Take off the suit that you've been wearing and wear yourself, be yourself, wear what you were born as mentally. And cross-sex hormones allow people to do that. Decreased depression was something I noticed. So going into my gender transition, I grew up a depressed teenager, depressed child, depressed my whole life. And because I grew up in the 90s and early 2000s, pre-YouTube, I didn't know a whole lot about transgender stuff. And one of the pros of being trans in today's day and age is that you have access to things like YouTube and different resources that I didn't have 20, 25 years ago. But being able to be knowledgeable and understanding your condition is a pro in itself. Having access to resources is a pro in itself. There are a lot of wonderful things that go in to these HRT transitions. These are medical transitions. I'm speaking directly about medically transitioning. I do believe that if you're not medically transitioning, there's really no point in considering yourself transgender because, face it, if you're not trying to change your body for gender dysphoria, you're probably doing it for the wrong reasons. Being able to look in the mirror is a wonderful pro. Being able to date can be a pro and a con. But one of the benefits of transitioning into a female is that the dating pool is going to change for you. You may find men more attracted to you than as your male self. Even if you are prefer men, hypothetically. I preferred men going into this, and growing up, I always fancied men over women. I'm bisexual, but prefer men. And transitioning into a female has allowed me to even have access to dating a straight man. Not all men are able to date trans women, and that'll be in the cons list. But overall, it opens up your dating pool. It gives you a lot different options that you may not have had pre-transition. And a lot of people that are pre-transition don't want to date because it makes you too dysphoric. Transitioning allows you to open up your life, to express yourself, to look the way you want to look, and to date people that you want to date. And most importantly, it's going to alleviate your gender dysphoria. It may not completely remove it because I don't think gender dysphoria can be eradicated. You're always probably going to feel some sense of gender dysphoria. People claim that there are transgender people that transition without gender dysphoria. That confuses the ever-living crap out of me because why would you go through this in order to transition if you don't have gender dysphoria? It's such a cumbersome and lifelong process that I wouldn't do this if I didn't absolutely have to. Now let's go into the cons. Some of the cons are they're hard. In a way, you almost sell your soul. What I say that is you are erasing who you used to be for all intents and purposes and are going to be replacing them with a woman. And what I mean by that is that you are essentially, it's the closest you coming to unaliving yourself without unaliving yourself. The male version of you ceases to exist over the course of years in the medical transition. The man that I was before my transition, I still am him. And everything that I did as him helped me get to where I am at now to be me, she. But there is a chance that you may lose loved ones. There's a chance that you may lose friends. There's a chance that you may lose children, or you may lose parents or aunts, uncles. I mean, it goes on because people don't understand transitioning. And face it, it's kind of weird. Most people don't just change their sex. You can't change your sex, but for all intents and purposes, change your sex. That's weird. And to most people, it's strange. It makes if you're transitioning in a neighborhood you've lived in, your neighbors are going to wonder, why are you starting to wear female's clothing? You're going to face scrutiny, judgment. There's a stigma. This is another con. The stigma tied to being a transsexual woman. Like anytime I go to a new doctor, sorry, my kitty cat just keeps hopping up. They're going to want to give you HIV tests. That's like, if you go to a doctor that doesn't know anything about transgender people, the first thing they're going to probably do is order you an HIV test because of stigma. Nothing wrong with getting getting tested. It's important to get tested, but a lot of doctors don't know what to do. If you're in a small town, maybe you live in the South where there's not a whole lot of transgender people, it can make you feel like an odd man out. Meow Meow gets shy in these videos, but this is my baby girl. I love her very much. Anyhow, Transitioning, the other thing is that you are indentured to doctors for the rest of your life. Pardon me. You're going to have to see a doctor, you're going to have to get refills on your prescriptions, and you're going to have to take HRT for the rest of your life. And that's a day-to-day commitment. That's an everyday commitment. Sorry, I got my cat bowls over here, and my cat is trying to eat, and I don't want that noise in the video. So meow meow, I'm sorry, you're going to have to wait to eat, sweetie. Paying for the doctor appointments, paying for the blood work, paying for your prescriptions. In transitioning, you're going to learn everything costs money. I mean, everything costs money anywhere, but especially in a transition. You have doctor appointments, lab work, hormone expenses, insurance co-pays, and then if you decide to take surgical intervention, then you're going to have, surgical costs. Now, a lot of health insurances do cover these procedures because being transgender means you have gender dysphoria. Gender dysphoria is a medical condition. It's a psychiatric illness. It's an ailment. It was formerly referred to as gender identity disorder in the DSM-5, and they reworded it and called it gender dysphoria to make it sound nicer. But it's an identity issue. And there's going to be people who are just mean to you in life. You have expenditures, you're going to incur some losses. I guarantee you, if you do this, you have to be willing to lose anyone or anything, because this is a process where other people, regular people, cannot empathize. So you're going to experience an extreme lack of empathy in your life from loved ones, even people who really care about you. But you're going to be able to build a new friends and new relationships and new families, having a chosen family. A chosen family is common in the trans community because so many of us lose our family. I'm so grateful that I have a mother and a father that still love me and accept me. Most trans people don't have that. Now, another thing that's going to be a con is surgery. It's not easy to recover from. If your insurance doesn't cover it, it's very expensive for facial feminization. So I spent about $11,000 on my face for a rhinoplasty, and I had a cheek augmentation to round my face out. And I'm going this December for a revision on my rhinoplasty and a brow bone shave. That's why I wear bangs, because I don't like my forehead. You may be indentured to surgical revisions like rhinoplasties. You're almost always going to have a revision at some point. There's always some hiccups or bump in the road that you're going to come across during surgeries. I cannot speak for sexual reassignment surgery because I have not had gender reassignment surgery, but intend on getting so. Makes dating hard because you can be the prettiest girl in the world, but if you have a penis, it's really hard for people to wrap their heads around that in a romantic setting. It opens your dating pool to a lot of different people, but it also closes a lot of doors in the dating pool, because being trans is a deal breaker for a majority of men and a majority of women. So overall, it can complicate dating and make it more complex. There's a lot more. You have to explain yourself. And when you start dating someone, that can take months and months and months of explanation just to get a man comfortable enough to be able to get an erection. I mean, you wouldn't believe what people go through and trans women go through in romantic settings. Now, these are just a couple things. I could make a 2-hour-long video and still not cover everything, but I don't have the time to do that. I make these videos to help others and just, give y'all some informed content, because you're going to sign a paper of informed consent, and that more or less is not fair. And I really think they need to gatekeep hormones, because we have a lot of people who are transitioning for the wrong reasons, and that they're appropriating transgender culture for the wrong reasons, and it gives transgender people a bad stigma And that's why the trans community has seen such a decrease in acceptance over the past decade, is because we have all of these people trying to be they, thems, and just things that people can't wrap their head around. Anyhow, if you found this video informative, if it helped you in any way, I'm very happy to hear that. Please go ahead and comment. If you have any questions about your transition, or if you're considering it, or you have a loved one that is considering doing this, please talk to your doctors. Please talk to your family. Please talk to your loved ones. Don't keep this inside, because that can create life, and that can create pain in your life. And that can create a lifelong issue if you don't address it. Anyhow, pardon me, I'm getting caught up on my words. It's been a pleasure making this video. I hope everyone learned something. And until next time, like I said, I will respond to your comments, and I will see you later. Bye.